Yeah. So the next condition is anxiety disorder, or maybe phobia.
Okay, anxiety disorders is a group of disorders. When you just say anxiety disorder, so maybe I could talk about what you just said, specific phobia.
Yeah, phobia.
Now, specific phobia, I believe everyone, must be everyone. Everyone has a particular extreme fear, not just fear, an extreme fear of something.
Yeah,
Yeah, that is not necessarily harmful.
Yeah.
That's specific phobia. So you need to differentiate between phobias and fear. Fear is normal. Fear is really normal, by the way. Like if a lion just walked in here.
That's fear.
Yeah, not even a lion, just a big dog. Like a very big bulldog. Just walks in here. See, of course, we'll all be afraid. So yeah. So that's fear. That's normal. A fear is simply a reaction to change in stimuli. Whatever sparks up that phobia in you. There's this intense fear, like you can't even move. You sweat. You're really tense.
Yeah.
Yeah, you get. Yeah, now that's phobias, and there are so many forms of phobia, and many more will come up. You see, it's the world; everything is evolving.
Yeah, many types of phobia.
Yeah, there's the one I just said, claustrophobia, fear of confined places. There's glossophobia. Those are people who can't give a public speech. You give them a microphone, they start shaking, they sweat.
But you know,
they could even faint.
But for some people, it becomes to be a chronic phobia when it's persistent.
Yeah, you know, there's stage
so
fright.
Serious.
Yeah, there's stage fright, and there's
thank you.
Yeah, and there's glossophobia.
Yeah.
So stage fright is normal, like even in church, you see it even in church.
Yeah.
Even a few pastors say like, when you're totally used to your congregation, but when you get to another church to give a preaching,
it's different.
Yeah, so you get that stage fright at first, but in a few minutes it's gone.
Do you know I used to cry when I'm put to like speak even in front of my relatives. Literally, I used to cry, and I can't even say the reason why I used to cry. You know the thing about this, for it to be that serious, maybe you can't be able to control it. That's why it becomes to be a serious phobia. Like I used to feel like these people intimidate me. There's just so many. I used to really cry, and people would wonder like, "Why would Beth cry? Why are you crying?" They think I have a problem, but I don't have a problem. I used to know I don't have a problem. It just happens whenever I go in front of people.
Yeah, it's normal. That's normal.
So in some situations, you'll find somebody does not fear heights. Maybe when you're used to that place.
Okay, let me say, I'm just afraid of heights. I don't have the phobia itself.
Exactly.
Yeah, like I could get to KICC, do a video there, take pics, but as in I can't stay there for long. Like I can't look down. You get?
Yeah.
I can't look down.
So do you get?
That's
do you get sweaty the way you say the symptoms? You don't get.
I don't get sweaty. I just have fear of heights, but it's not extreme. It's not an extreme fear. Yeah.
But to some people, it gets extreme.
Yeah, there are people who can't do that. Like they'll just tell you no.
I can't.
You know, the fear of heights, the phobia, the phobia of heights, acrophobia. It's a person dealing with acrophobia. Most of them can't climb up 4 steps of a ladder.
You can't even go up a stairs as much.
Yeah. So it's that serious. So phobias, they need to be treated. It's a specific phobia. It's an anxiety disorder. Yeah, but fears are normal. If you don't fear anything, maybe you have maybe a deficit of a certain neurotransmitter. You get?
Oh yeah.
Yeah.
So the next disorder or condition we're talking about is schizophrenia, the one he's been really mentioning, and you've just been flossing. Yeah.
I've been flossing.
So help us understand what schizophrenia is.
Okay, schizophrenia. This is a mental illness that affects our thought process.
Yeah.
Yeah, our thought process could affect your mood and just how you view things. Maybe if I talk about the symptoms, people will get to know what it really
Okay,
is.
please.
So schizophrenia has two classes of symptoms. There is positive symptoms and negative. But let's talk about positive symptoms because those are the things we see daily. The negative symptoms. Personally, I've personally only seen maybe just a few patients with negative symptoms. But let me talk about positive symptoms. And
what do you mean by positive and negative symptoms?
Okay. Oh, sorry. By positive symptoms, I mean symptoms that include hyperactivity, a lot of activity within the individual. Yeah, but negative symptoms, there's little or no activity, like the individual does not involve in anything.
Oh, so you mean that the positive ones, at least you'll be able to see and know that this person has a condition. But the negative ones,
you might
like,
see it and you're not
what's
sure.
the problem?
Yeah, maybe he's just
Probably,
tired.
Yeah, maybe.
Because maybe the guy is just lying in
We
bed.
make so many assumptions at that point.
Yeah, maybe the guy is just lying in bed or just seated on a chair and just looking at one point, and you're like, maybe the guy is just lost in his thoughts. So the positive symptoms I'll talk mainly on hallucinations. There's hallucinations and there's delusions. Hallucinations refers to perception of something that is not existent, something that doesn't exist. And there are very many hallucinations. Okay, not very many, but a number of hallucinations. There is visual hallucinations, where you see things that are not existent. Maybe you see, maybe let's say this place is lit on fire. You start saying, hey,
but it's not actually on fire.
Yeah, but there's no fire. Then there is auditory hallucinations.
Like the one you hear.
Yeah, you hear things that are non-existent, maybe. Then there is tactile hallucinations. Tactile feeling. So maybe you start feeling something touching you. Yeah, touching your skin, touching your head. Yeah, and you're like, hey, get off me. Yeah, but there's nothing there actually. Yeah, then there is audio-visual, like you get, it's a combination of audio and visual.
Yeah. You see and hear things that don't exist. Yeah.
Just say this guy has schizophrenia by looking at one symptom. Yeah, you need a couple of symptoms, maybe 6, maybe 7. Yeah, and for a certain duration of months, maybe 6 months, maybe 1 year.
Wow.
So yeah,
that's schizophrenia. Okay.
Yeah, and delusions. Delusions are mostly our thoughts. You see yourself as the president of your city. You're a very important person. You're needed in the society.
You should not judge somebody with that condition, or you should not hide people with that condition.
As in, they could do everything.
They could.
They could learn. They could.
You
could sit in a class with a student with schizophrenia, and they'd be in class. Just all they just need is the right treatment and good exposure to the treatment. Yeah, and when it was like a positive environment, like they don't need constant put downs. Yeah, they just need love. You get it?
Yeah, they just need love.
Yeah.
Wow, that was intense. So the next condition is bipolar disorder. Okay, so please tell us what is bipolar disorder? Okay,
bipolar disorder is in the group of mood disorders, and it's characterized by mood swings mostly. A high, like you get to highs and lows. You get.
Yeah.
You're very excited at the moment, really, really excited. Then in the next 5 minutes, you're really sad. You're really upset. You want to hit me so bad. Yeah, that's that's the simplest explanation I could give about bipolar disorder.
Extremely happy and
Extremely happy,
sad
extremely sad.
at different
Yeah.
times.
And there are others who are generally just on a low mood. Always. Yeah, always.
Yeah. Oh, wow. So the next question that will actually probably shed some light on explaining how you can maintain your mental health positively, and also for those who have the mental health condition and probably are watching this video can really get to know that what can you do in case you have this condition, and how can I be positive about it, especially in the case of depression. What can I do to avoid getting depressed, or what can I do if I'm depressed? What is that thing I'm supposed to do to bring my mood back to how it was? So how can we feed our mental health?
Okay, feeding your mental health mostly starts with your environment.
Yeah.
So you need to have a favorable environment around you.
The people around you.
So if the people around you don't love you, they don't show compassion,
it will affect your mental health.
It will affect your mental health. You'll be stressed. You might be anxious. Whenever you need to get home, you're you get a bit anxious. You're like, how am I going to start today?
Exactly.
How will I say hi to him? How will I say hi to my dad? So the people who surround you also dictate. Okay, let me not say dictate. They also determine whether your mental health will be good or bad.
And there's something you mentioned earlier about having so many friends. You have 10 friends, 10 close friends, not just friends, but close friends. Okay, when you have 10 friends, this is a varied explanation to different situations. When you ask the first one, what do you think about this? They give you most of them will have different opinions about different situations.
Yeah,
and that is just how much it can affect our mental health. That is how much our surrounding affects our mental health. Because when you approach a friend and you're like, I think I need to probably change my life in terms of whatever you want to change your life to. I want to get more money or whatever, and you tell them how you want to get all that money or your plans. They all have different explanations, and when you adopt all of them at the same time, it gets to you too much information, too many things. I find stressed. Should I do this? Should I do that? And you also told me earlier before we started this discussion, and it's better to have very few close friends, even three friends or something. Because when you have these many close friends, I don't know, it just affects you sometimes negatively.
Yeah, it's normal. It's called association. Mostly in the human life, you use association while you're a kid. See, when you look out there, most of the small kids, the younger kids, they do exactly what's done back at home.
Exactly.
This kid will imitate the dad, this will imitate the mom.
Yeah,
the smaller kids. So association is also association also stays with us as we grow, as we become adults. In that, whenever, and it's unconscious, I'm with a friend, I'll tend to copy 2 traits or a few traits from them. And it's totally unconscious.
It's unconscious.
Yeah, it's unconscious.
But sometimes it's not really bad.
Yeah, it's not really
sometimes
bad.
you copy the good things.
Yeah.
But for it to be an issue, for it to affect your mental health, it might be something toxic.
Yeah. So let's say that's one friend you have. Imagine if you have, like you just said, if you have 10 close friends.
Well, if you have one friend affecting you like that, what if you have 10
what if you have 10 close friends that you give the same attention to, or even 5, or even 6?
Yeah, you won't be able to have yourself.
Yeah, you won't have the same mentality. You won't look at things the way you did. You get?
Yeah.
Yeah. So our environment. When we talk about our environment, the people who surround us is a very vital issue.
Exactly.
Yeah, so feed yourself with the right information from the right people.
Thank you. That has really been a good mind opener or eye opener.
Yeah.
Because honestly, we don't really know when these things actually creep in. When you can't really make a decision on your own, you need to ask, hey, so what should I do? You find yourself like, it's like you're being a robot. You know what you feed in every time as a robot, ndo inafanya kitu na feed in.
Yeah.
But sasa, I feel like individuality sometimes matter.
Yeah,
as much as you need to be associated with people, you need to also be yourself.
Yeah.
For you to make reasonable things that, we don't really know what somebody else can't know what maybe affects you or what maybe will work for you. Somebody else can't know. They'll just advise you, but you're the one to make the final decision to say that this works for me and I'll do this.
Yeah.
But when you have this valid friends telling you different things, friendship is good. You don't say friendship is bad.
No, friendship is good.
Yeah.
For it, but just have the right friends.
The right friends, exactly.
Yeah.
Not toxic people.
Yeah. And another thing about our environment is how to use it.
How to use it.
Yeah, like when you find yourself like you're leading to the root of bad mental health or poor mental health.
Yeah.
Yeah, you need ways of unwinding. You need to disconnect for a while. A while doesn't necessarily mean years or months. A while could be 10 minutes.
You need to unwind.
Yeah, it could be a day. It could be an hour.
Or take a vacation. Go for a vacay, but not with Corona.
Yeah.
Corona.
The best vacation it having with Corona is your room.
The best vacation is my room. No. I've been there like the whole.
You sleep.
I think the best vacation at this time to just unwind is just taking a walk. So we need to unwind.
Yeah, let's say walking worked for her. So like, as we know, we are all different.
Yeah, sure, we're all different.
Yeah, so let's say maybe you're stressed, maybe you're dealing with burnout and you have no idea, then it just hits you like, hey, this is burnout. What do you do about that?
Yeah.
As she said, you could take a walk. If it's stress, you could learn a new skill. Yeah, so unwinding simply means like just doing something that will help you relax, cool off the heat. Once I'm emphasizing on learning a new skill because let's say you're stressed. There's something that could stress you, for a lifetime. You get?
Yeah.
There are things that could stress you for a lifetime. You just hide them at the back of your mind. And once in a while, they get to the front of your mind again. Yeah. So whenever you're stressed, like learning a new skill will divert all your thinking to that skill. Yeah. And however long it takes, all your thinking will be to that skill. And after a while, you'll get back, you'll sit back and notice that whatever you were stressing about, I'm not saying that it will necessarily not be useful to you or be hurting or I don't know, yeah? I'm not saying that it's necessary that whatever was stressing you will only be a little thing at the end.
Oh yeah.
Yeah, but most of the times, you notice that whatever was stressing you, whatever was keeping you awake in the middle of the night won't kill you.
Yeah, it won't kill you. Yeah. What doesn't kill you makes you stronger.
That's a quote. You never.
Yeah, it's a quote.
Yeah, and there's another good illustration I once came across. Some Hindu illustration about stressors. Like the guy was asking, are you stressed? So you have a choice, yes or no.
No. They say no.
Okay, let me do it with you. Are you stressed?
No.
Okay, so why worry? See that?
Yeah, why worry?
Okay, and let's say you're stressed. Are you stressed?
Yes.
Can you do something about what's stressing you?
No.
Why worry?
I know. Like there's nothing I can do as at now.
Yeah.
Maybe it's past, but it's just coming up now.
Yeah. So why worry? As in, don't worry much about what you can't fix.
You can't change. Exactly. Yeah.
If there's something you can do about it, it will totally show up one day.
Yeah.
Yeah. So if you can do something about it, don't worry much. You'll do something about it. Either way, if you can't do anything about it, stop stressing much. That's where our spirituality comes in. That's where you need your connection with your
supreme being. Exactly.
Yeah, pray to God. Subscribe to the supreme being in your religion. Yeah. Everything will be good.
I think you mentioned about talking to yourself.
Oh, self-talk.
As a way of maintaining your mental health positively. Self-talk, yeah.
Yeah, self-talk. So, self-talk is just simply about, how could I put it? Just gauging yourself. Engage yourself in talks like, last month I did this and it turned out so good. I congratulate myself. Last month I did this wrong. I need to get it right the coming month. And if you don't get it right this coming month, you give yourself a goal. Maybe for the next coming 2 months, for the next coming week, I need to get this right. That's self-talk. Self-talk is not self-criticism. You don't hate yourself for doing this. No. You try to make the necessary changes in whatever you did wrong. You get? Yeah, so self-talk is really important. Like, it's some sort of meditation.
Yeah, it's like evaluating yourself.
Yeah, it's self-evaluation and it's really nice. So, because once you know yourself, you know your capabilities, you know your strengths, you know your weaknesses. That's gotten through self-talk. Yeah. Once you know yourself, you'll be good. Like you know where you're starting from. Yeah.
Oh, that's really nice. You even set yourself goals.
Yeah, you set yourself goals, and goals don't necessarily have to be something. You know, a goal has to be achievable. Yeah.
Measurable.
Yeah.
Smart.
Yeah.
Smart.
Exactly.
I'm learning.
Hey, so, I get. Yeah. So self-talk is all about goals and self-evaluation.
Yeah, that's necessary. And the next one, for those people who might have some of the conditions, who could be watching now and could be in that condition of I have schizophrenia, I have bipolar disorder, I have this phobia or just depression in its extreme. So in case those who have such conditions, what should they feed themselves to make them feel positive that you'll be okay in case you're depressed and you're under medication? What would you advise such kind of people?
Okay, those going through, let's just say generally, those going through cases of mental illnesses.
Yeah,
like what I'd advise is all you need to have is, first of all, resilience. You get recognition, then resilience. Once you recognize that I have this disease, you need to be resilient in order for you to get over it. As in, getting over it doesn't mean you're healed. You're cured. Getting over it means you've accepted the fact that, let's say, I have bipolar disorder, I have schizophrenia, I have ADHD, I have any mental illness of the sort. Once you've accepted that you have this mental illness, seek help.
It's about first accepting, and then seek help.
Yeah, you seek help. Yeah, after seeking help, by seeking help, ni wewe mwenyewe kwanza.
Exactly.
You speak out. You don't feel afraid that, hey, how will they judge me? No. Get to the medical center. Tell them I feel this and this and this. There is no single doctor in this world, or psychiatrist or psychologist, who's straight. Mwenye utamfikia and they be like, no, I can't help you.
Exactly. And I feel for us to make maybe people with such issues come out and say that I battled this and it went through well for me. I understand my situation and I am ready to also help other people who might be facing the situation. For them to reach that point, we also need as a society or as the public to feel them, to make them feel comfortable.
Yeah.
You know, to make them feel like it's not like it's death sentence for you to have bipolar disorder, for you to be depressed. It's not a death sentence. You can actually, for them to feel ready to speak out to other people and encourage them facing that situation, is if we as a society destigmatize people, we destigmatize the situation of not talking about mental health.
We have to stop using mental illnesses as adjectives.
Exactly.
Yeah, so
please
you're
explain
like,
that.
Why is my mom so psychotic today? Like, hey, your mom is not psychotic. Why are you acting bipolar? Eh?
It makes people in such conditions just
why
shrink.
are you trying to get mental? As in, hey, no.
It will make such people shrink, and it's not actually the best thing. You know, it's not. I mean, like we really need to create this awareness.
Yeah.
And as you who are watching me, I would like to ask you to also try as much to also appreciate people going through such situations, because there's also people out there, if you go through social media, who have actually faced that situation and are also championing to create awareness that mental illnesses is normal, and you can actually do the normal things people do once you seek medication.
Exactly.
You know, and we also need to appreciate like such kind of people for getting that boldness of doing that, you know. Isikuwe ni kama ati unashtuka, she came out. So you start meaning them, like
putting them down,
putting them away. You know, the way some people I hear in the news, there's this interpreting from people who had earlier got corona. They're avoiding them. It shouldn't be like that. Mental health is not like diffusion, like the way corona is. It's like, if he has it, I need to appreciate him no matter what. Because we learn to live with it and make them feel comfortable in the society. Because the people out there maybe who have it and who have maybe battled with it and they're okay, but because of that fear of judgment, they can't come out. So we are done. And Suma, do you have anything else you can say to people, advice to anyone?
Okay, maybe just not to the ones having the conditions, but to the ones relating to those having the conditions. Like, just as you've said, anyone with any mental illness needs special attention. Because this is something to do with your mentality, something to do with the brain, with the mindset. You need to give that person extra attention. You need to learn the way they view things. You need to appreciate the fact that they're still alive, and the fact that they're trying to battle something not everyone has. You get? So mental illness is just like any other illness out there, and you don't have to stigmatize anyone with any mental illness of the sort.
You don't have to, exactly.
Because once you put them down, they really tend to give up.
They tend to give up, and that's how they lead to suicide.
The self-harm.
Exactly. Self-harm.
Something of the sort. So be nice to everyone. You never know who has mental illness around you, because they don't easily come out. They don't easily speak about their conditions. So if you're out there, be nice to everyone around you.
Be kind.
Be kind.
Actually, the theme for this year on mental health wellness was being kind. So be kind to everyone around you, whether or just be kind to everyone. Everyone in general. And also a big up to their caregivers. Big up to their caregivers. Exactly. And I wish you all the best as you are in that path. And honestly speaking, if this guy doesn't be your next psychologist in the future, I don't know who is. Yeah, I'm just giving you credit.
Thank you.
Yeah.
Yeah, thank you.
Yeah, and thank you so much for coming to have this interview. It's an interview or a discussion. I don't even know what to call it. But as long as we have spread the word out there, that's the most important part.
Sure.
Yeah, so kindly follow him on Instagram at tony.eldridge. I don't even know why you didn't have an underscore, like Tony underscore. Why the dots? Me, the first time I was putting my Instagram handle, pet underscore Adhiambo. That underscore was just a thing for me. I wanted to be different.
see, we've already heard of the last name.
Okay, sawa. Sawa, it's okay. And thank you guys for watching this video. I hope it won't be too long because we've actually had a lengthy discussion.
Sure.
Like it has been lengthy.
Yeah.
I'll try to edit and make it a bit short and nice and educative. That's the most important thing. Sure. Educative. And remember, there is no health without mental health. So guys, have a lovely time. And subscribe. I usually keep forgetting to tell people to subscribe to my channel. Subscribe to my YouTube channel. If you're new here, Pet is my name. It's Pet. Kindly subscribe and see you in my next video. Yeah. So subscribe. Subscribe.
Cool.
For sure. Please subscribe to my YouTube channel.
Okay.
Bye.